Hey everyone, in this video we're going to go over MCL sprains. So that's the medial collateral ligament on the inside of the knee. Those sprains, and then what can you do about it to kind of get back some of your mobility, your range of motion, and help with your pain. Now these sprains are graded 1 through 3. So a grade 1, there's a little bit of micro trauma here, no real instability, maybe a touch of instability. The knee is painful, a little swelling on the inside. The MCL has a good blood supply, so you may notice some swelling on the inside of your knee. So you don't have just this huge amount of instability. Well, a grade 2, a little more to that. Now we're going to have some instability. We can even have difficulty, bearing weight or loading weight through the joint. And then a grade 3 is going to be that complete cut or tear of the MCL. So now we're going to have instability, and now we're going to have usually a decreased ability to load weight through the extremity. So what typically will happen, the mechanism of injury, is someone hits you from the outside. So this is coming from the outside of my knee in, and it causes this what's called valgus force. So that valgus force, and you can see how I'm stressing that MCL ligament right here when I do that, and that can cause tearing. And there's been some research to support that it needs to be around a 20 degree or so your knee is bent. So maybe you're running, maybe you're playing soccer, football, whatever, and you plant your foot and you go to turn, or you just plant your foot and your knee is bent a little bit, and then you get hit from this side, and that can cause that as well. There's some other structures in that area, the pes anseron, there's some tendons, you have meniscus in here, so sometimes it can fool you a little bit. You may not be exactly sure what's going on, but typically differentiating that between the meniscus, and there are tests for the meniscus as well, it would be the rate of swelling. So typically the meniscus might not swell as much because it has a poor blood supply, whereas the MCL is loaded with blood, so large blood supply is going to swell. And a lot of times the patient's going to have a little inability, so my knee is bent, right? So the foot would be down here. So the knee is bent, and they're going to have trouble flattening out the knee. That will be painful, as well as going into in-range flexion and bending the foot back underneath you. Both can be painful, but a lot of times that patient's holding their knee with a little bit of flexion there, just bent a little bit. So I'm going to show you, go through 2 phases, 2 of the 3. The third phase with the kind of home MCL recovery is going to be where you're returning back to your skills and your drills and running and plyometrics and all those kinds of things. So I'm going to show you the first 2 phases that you would do. So in part 1, which is going to be weeks 1 through 3, we're going to work on really restoring range of motion, kind of reactivating that quadricep muscle, getting that going again. And so what I'm going to do is we're going to say it's my right knee that's affected here, right on the inside right here. And I'm going to put this band around my foot. Now, you don't have to have a band. You can use a towel. I've had patients use ropes, all sorts of things. So I'm going to put that around you. If you see kind of how I wrap it around, so I've got it on both sides, and I crisscross like that. And so then I'm just going to kind of pull back, and I work on pulling my knee back as far as I can, and then sliding back down. Now this would work better if I were just in my sock, instead of having my shoe trying to slide on the mat, and I pull it back, go as far as I can, and then come right back down. And I would just work on that for maybe 10, 15 repetitions, maybe even 20 repetitions, and I would do that, several times a day just to try to restore that range of motion. Now we're going to perform quad sets. I've done this exercise in a lot of the videos, and so I'm going to use this half bolster here. You can just kind of roll up a towel or take a small pillow, put it behind my knee here. Okay, so I'm going to put it behind my knee, and I'm going to focus on tightening up my thigh. Right, so I'm tightening up my thigh. I like to pull my toes and foot back up to me and push the back of my knee down into that bolster or cushion or rolled up towel, whatever you're using. So I'm pushing that down, really focus on holding this. I'm going to hold that maybe for 10 seconds if I can, maybe less. Initially it's painful, we only can do 3 to 5 seconds, but work on 10 seconds, really pulling that foot back, flattening that out, hold it, and then relax. And then I'm going to do that same thing again, tighten up my thigh, pull my foot back, push down, hold that, shoot for 10 seconds, and then relax. As far as repetitions on that, I usually tell patients just do whatever you can. Of course, those 10 to 12 repetition range is something I'm trying to shoot for, but if you can't, even if it's 2 or 3 repetitions, just to start activating the quad is the goal with this exercise. Now we're going to do straight leg raises. Again, this is all in part 1. So there's 3 exercises that we're doing, or movements within part 1. So it's my right knee again. And so what I'm going to do now, I'm propped up here against the wall, but you can lie flat on your back, whatever you want to do. I will tell you lying flat on your back is a little bit more difficult than sitting up first. So I'm just going to focus on tightening up my thigh, pulling my foot back up to me, and just bringing the back of my calf just a little bit off of this mat, whether that's the bed, the floor, whatever you're on. You're just going to hold it, and then back down. And you only need to hold that just a few seconds and come right back down. Really focus on tightening up the thigh when you do that. Now again, you can do that lying on your back. You can do that, kind of elevated with a pillow behind you. It doesn't really matter, but it will be more difficult in those positions versus sitting up. So maybe initially start doing it sitting up, and then you can go on your back with a pillow under your head and your back, your upper back, and then go flat of your back. And you want to complete somewhere between 2 to 3 sets, 10 to 12 repetitions. Now we're going to go into part 2, and part 2 is going to start at about week 4. Now that's not wrote in stone, it just depends on how you feel. If we're just going by how long the healing timeline for this is, I just kind of pick 4 weeks. That's typically what I do with my patients. So we're going to start this, and this phase is going to last from about 4 weeks to 6 weeks. Now again, these are not all the only exercises or movements that you would do. This is just to keep it really simple to give you a starting guide that you can do at home. The first one we're going to do is leg extension. So again, we're going to say it's my right knee. Remember that MCL is on the inside here. I'm going to kick my right knee out. When I kick it out, I'm going to pull my foot back up to me, really focus on tightening up the thigh. So I'm going to kind of show that from the side so you can see. All right, so I'm kicking my knee out, tighten up my thigh, bring my foot back to me, hold that, and come right back down. Go back out, tighten up my thigh, bring my foot back, come back down. Now you can add a leg weight to that. I usually tell patients, do that a few days, then you can start adding a little 2-pound cuff weight or leg weight to that. You can use those bands that attach to those little straps and go behind the lower leg. That's fine too. Don't get too aggressive too fast, but I mean, you want to definitely start loading that in with a little more resistance, at least after the first week or so. Definitely start adding resistance to that. You're going to complete 2 to 3 sets, 10 to 12 repetitions. So what you're going to do, lean against the wall, you put your feet out from the wall, just whatever feels comfortable. As far as the width on that, I don't actually care, just whatever feels comfortable to you. And then you're just going to kind of come down a little bit, and then we're going to sit there. That's a high wall sit. We're going to start with that. We're going to work on doing that, holding that maybe for 10, 15 seconds and then back up. And then I'm going to slide down again, 10, 15 seconds and back up. Next, we're going to progress. I usually have my patients do that for maybe 2 days, 3 days. And then we're going to go to a deeper wall sit. And we're going to hold that. The high wall sit we're trying to hold maybe for 10 seconds. Okay, so when we go down, that's a little more difficult. Let's just focus on 3 to 5 seconds on that one, okay? And you're going to repeat that for 2 to 3 sets of about 10 to 12 repetitions. Now when you become comfortable with that, so we started that in week 4. So at about week 5, in the middle of week 5, we're going to go to freestanding squats. So you're just going down in a freestanding squat. You can put your hands out, you can hold on to a chair, you can put your hands on your hips. Doesn't really matter to me. You just want to go through a squat movement and come back up. As far as how deep, I usually start partial squats, and then you're going to go down deeper into a full squat as you feel comfortable. So I definitely, for me, I usually don't add heavy weights or like a barbell squat or even kettlebell squats, dumbbell squats until about so week 6, week 7, in that range. When we start our skills and our heavier exercises, then I'll start adding in those heavier squats. Our third exercise in part 2 is going to be step ups. So I have a couple of foam pads here kind of stacked up together. You can use a step, or if you have steps at your house. And I'm just going to work on stepping up with my affected leg first and then back down. So that's my injured leg there. I go up and back down. And you're going to want to complete somewhere between 2 to 3 sets, 10 to 12 repetitions. Make sure that you're holding on when you first start doing that, especially if you're unstable. You don't want to fall. But then after you feel confident and your stability feels better, you can definitely let go and do that without holding on. Thanks so much for watching this video. I hope it helps to try to restore your range of motion, decrease your pain, and improve your stability after an MCL sprain. Thanks so much.